Beware. Back pain is one of the most common disorder. Almost everyone in their lives have been affected by it at least once. It is surprising to note that low back pain is considered as the fifth common reason of patient visit to physician. Debilitating sufferings are associated with injury, fall, or multiple reasons, and they must be diagnosed correctly. Firstly, you should know that back pain is defined as stiffness and pain centered anywhere in the back, sometimes radiating into the legs or buttocks, and possibly originating after heavy lifting or injury. Secondly, you should be aware of all such aggravating factors: coughing, sneezing, walking, movement, and menstruation. In the next phase, you should be aware of all such factors that are helpful in relieving pain, which includes antacids, leaning forward, and bed rest. The most common form of back pain results from strain in the lower back. Now, there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including urinary incontinence, difficulty or pain with urinating, blood in urine, pain or numbness in the buttocks or legs, abdominal pain, hip pain, fever or chills, nausea, vomiting, flank pain, vaginal discharge. You will also ask the patient whether they have ever had an X-ray, CT scan, or MRI of their spine, or any other tests of their backbone, and what they showed, and whether they have ever had surgery on their spine. You will ask your patient if their back pain began after a back injury or fall, and the precise location of the pain. You will ask the patient if they or anyone in their family have had any of these conditions: cancer, recent surgery, or spinal fracture. You will ask the patient if they are taking any regular medications, particularly steroids or anticoagulants. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes pushing on abdomen, listening to patient's abdomen with a stethoscope, pelvic exam for women, muscle spasms, tenderness in the back, spinal curvature and flexibility, reflexes in the legs and feet, strength and sensation in the feet and calves. Well, there are different causes of back pain that you should be clear about. Now, if the patient shows symptoms like muscle spasms near the spine, and pain does not move to the legs, and often begins after lifting, then this might give you an indication that the patient has muscle strain. Well, muscle strain is injury to muscles. But if your patient has typical symptoms like severe, persistent pain, tenderness, often the result of back injury or fall, then this might be an indication to spinal fracture, which is a break in one of the bones of spine called vertebrae. And what if your patient is having constant and progressive back pain lasting several weeks, maybe history of recent infection? Then these symptoms might be caused by osteomyelitis, which is in fact a bone infection. And if back pain is accompanied by limited range of motion of the spine, often accompanied by pain in other joints, more common in the elderly, then osteoarthritis might be a reason to this. Well, this is characterized as the most common form of arthritis, or inflammation of the joints. Now, if the patient has back pain along with stiffness, lower back pain, reduced flexibility in the spine, more common in young men, then this might give you an indication that patient has ankylosing spondylitis. Well, ankylosing spondylitis is defined as arthritis affecting the spine. Now, if the patient shows symptoms like painful skin sores, then this might give you an indication that patient has shingles. Well, shingles are reactivation of the virus that causes chicken pox, more common in the elderly who have had chicken pox. Now, If the patient shows symptoms like abdominal pain or tenderness, pain in the mid-back region, sometimes relieved by antacids, then this might give you an indication that patient has peptic ulcer. Well, peptic ulcer is defined as severe irritation of stomach lining. Now, if the patient shows symptoms like pain in the upper abdomen, sometimes the back, nausea, vomiting, sometimes weakness, and associated with history, rapid heart rate, then this might give you an indication that patient has pancreatitis. Well, pancreatitis is a state inflammation of the pancreas that produces insulin which regulates sugar, often associated with history of heavy drinking or gallstones. What if your patient is having acute upper abdominal pain? Sometimes a pulsing can be felt in the abdomen, more common in people over age 50. Then these symptoms might be caused by abdominal aortic aneurysm, which is in fact a condition of swelling in the aorta, which is the largest blood vessel in the body. What if your patient is having history of passing gravel or blood in urine, severe pain radiating to groin and testicles? Then these symptoms might be caused by kidney stones, which is in fact the presence of stones made up of mineral salts in the kidneys. What if your patient is having pain in the sides, upper abdominal tenderness, difficulty pain or blood with urination, and fever? Then these symptoms might be caused by pyelonephritis, which is a kidney infection. What if your patient has pain in the lower part of the abdomen or sacrum, vaginal discharge? Pain may change according to menstruation. Then these symptoms might be caused by gynecologic disease, which is in fact a disease affecting the reproductive organs in the female. What if your patient has back pain, along with changes in urination, lower abdominal pain? Then these symptoms might be caused by prostatitis, which is a state of infection or inflammation of prostate. What if your patient is having pain radiating to legs, inability to move legs, trouble moving legs, bladder problems, often the result of spinal fracture caused by an injury? Then these symptoms might be caused by neurological damage, which is a damage to the spinal cord. What if your patient is having pain radiating into legs or buttocks, aggravated by sneezing or coughing, often begins after lifting? Then these symptoms might be caused by herniated intervertebral disc, which is a disc in between the vertebrae, protrudes into the space that holds the spinal canal, squeezing it. What if your patient is having unsteady walk, thigh weakness, lower back pain that radiates into the thighs, often relieved by bending forward? Then these symptoms might be caused by spinal stenosis, which is a narrowing of the spinal column that leads to the pinching of the spinal cord and the nerves. And lastly, if the patient has severe, progressive pain, more common in older patients and people with a history of cancer, then this might be an indication that patient has tumors in vertebrae, which is defined as malignant and abnormal growth of cells in the vertebrae. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of back pain. Stay tuned to sqadia.com for more such videos.